Hey, it's Fly Ty, and I'm hanging out with one of my good friends, Dr. Richard Natale. He's the president and urologist at Carolina Urology Partners, and I'm excited to be with you today because we're going to get some great information out to all of our viewers and our listeners today.
Yeah. I absolutely agree. I love it. It's been a long time since I've seen you, man.
It's been a long time.
All this COVID stuff has been tough, but we worked through it. Now we get to hang out.
But that don't stop the issues that men are having.
Exactly right.
You know, a lot of people found out during COVID that they had some issues.
Exactly right, man. Yeah, because you're staying at home now. You're not distracted with all the other stuff going on.
Exactly.
And, performance issues and all that start coming up.
Speaking of performance, talking about one of my favorite subjects, ED.
Yeah.
A lot of people don't know what ED stands for. It doesn't mean education. Well, it is some education. It can. But let's talk about exactly what is ED.
Okay. So ED stands for erectile dysfunction. That's when you can't either get it up or keep it up for what you need to get done with. All right. So it doesn't mean that it's floppy noodle stuff. It can just be, I can't keep it up good enough to make it to the end of the act. So that is erectile dysfunction.
Okay, well, you're talking about it. What is exactly it? I think they may know what we're talking about when you're trying to satisfy your partner.
Yeah, when you're trying to satisfy your partner, exactly right. I was trying to come up with something I could give you that's a little bit slicker than that, but it's when you're trying to satisfy.
I think it is pretty good. Well, how common is ED?
You'd be surprised. I mean, we're talking about tens of millions of people across the United States. Men have this trouble. It's crazy. We can see it as early as in their 30s.
Wow.
Oh, yeah. You're talking about probably 30 million men, maybe more. Oh, yeah.
Wow. That's huge numbers, so it's really affecting a large part of our population. And does age even matter in that?
Yeah. As we get a little bit older, you're going to start having more issues, because then you start getting the medical problems that come with age, right? High blood pressure, diabetes, low testosterone issues, things like that. So as we get older, we start struggling more with that stuff. And that's what happens. So that kind of accompanies it.
Well, you found out the secret because you're looking amazing.
You're
looking amazing. Last time I seen you, you done trimmed up a little bit, looking real good.
Yeah. 50 pounds, working out, doing all that good stuff.
Wow. And some of those natural things like working out and exercise probably could help it, but I'm sure there's some men like, hey, doc, everything that I'm trying, it just seems not to be working.
You hit the wall, you try. I mean, I always encourage my guys to do that stuff because it's just healthy living. You want to be able to make sure you're taking care of your body. But with that being said, some of that stuff, you hit the wall, you say, I've tried it all, doc, it doesn't work. What else is there? And then we have to start talking about treatment options outside of, lifestyle changes. Yeah.
So if you can find out exactly what causes it, maybe you can treat it. So what are some of the main causes of ED that you see?
So the primary stuff is going to be related to your blood flow in problems. So it's going to be stuff that kind of reduces the blood flow to our penis. High blood pressure issues, medications effect of that to, bring your blood pressure down, cholesterol issues. Guys, for example, guys who have cardiac disease, right? So we actually know that the erection is like a canary in a coal mine. A guy who has ED first, about 10 years later, may have a heart attack or have some coronary artery disease. So we definitely know it's a blood flow in phenomenon for the most part. Now, there's other things that are there, hormonal, neurologic, the effects of surgery. But for the most part, what we're dealing with the most is blood flow in.
Wow. So if you can get that blood to start pumping, then you might be able to get
going what you need to do.
Get going.
Get going to that it we just talked about. That it of satisfying your partner.
Yeah. All right. So at what age do men usually start, feeling these symptoms coming on? Like, what is going on with me?
All right. When you'll start seeing the issues, really the peaks are around the 40s to 50s when you start seeing that problem and it progressively worsens over time. So while we see some folks in their 20s and 30s still, and I definitely treat those types of patients, the most common age is going to be about 50 plus.
Wow.
Yeah.
Wow. Well, now's time for me to dive into some hard questions. I'm gonna do it all. I'm gonna do it the whole time. Hey, that's what we try to get to.
That's right. That's exactly right. The heart of the matter. We're gonna drill down on stuff.
There you go.
Right?
There you go. So listen, stand up at attention because this is some great information you don't want to miss. What treatment options all day.
All right. So we talked about the lifestyle modification stuff, and we'll get into that a little bit later as well. But when I got a guy who says, Doc, I've tried all that stuff, pills. We're going to try the pill first.
Yeah.
You've seen the
talking about that little blue pill?
Oh, the little blue pill.
Oh, I get it. Yeah, they used to sell them in the hood for $10.
We're not sure what they were, but
I didn't know, but I get it.
If it works, it works. Yeah.
Hey.
I mean, because that's going to be the easiest way to go. Now,
Yeah.
the problem is that the pills, it's like, it's not natural. You got to plan it out. You know, and if your wife's anything like my wife, if I tell her, it's like, hey, it's 7 o'clock, I took my pill.
Yeah.
I need an hour or 45 minutes for them to kick in. It's, things ain't going to happen.
The worst thing that can happen is you take that pill and she's like, I'm tired, I'm going to bed. You're like,
right, yeah.
What am I supposed to do?
Yeah, the kids walk in the room, you're like, Daddy's I got 40 minutes, let's get out.
Yeah.
Yeah, so, but the pills, look, you take them because they're simple, they're easy, everybody knows them. And if the pills don't work, we have other options. Usually things like injections, believe it or not, are kind of the next step. They have some other not as sexy options as well that involve vacuum pumps and all this other type stuff. But I typically will go from pills to injections next if you fail the pills.
So, talk to that person who's experienced ED right now and who's saying, I don't necessarily want to get on medication. I want something. When I want it, I want it. You know what I mean by that? Something that may be a little more permanent. What would you say to them? What would your first recommendation for them to do?
Well, right now, at this time, what we have available is the penile implant. So there are some guys who say, hey, the meds don't work, or they work kind of half the time, and I'm kind of dissatisfied with how everything's performing. Oh, we can do surgery and correct the problem. We get an implant in, we can actually reverse the effects of what aging and all those other things do and get you a solution to the problem.
Wow.
Yeah.
That's really good. So, talking about reverse aging, this is kind of like the fountain of youth. Like, whoa, baby, I didn't know you still had it like that.
I'll give you the Energizer Bunny, man.
Yeah.
Because once you get going, you can keep going.
Now, talk about some great experiences. So I know some guys that have come to see you. They're like, Doc, you changed my life.
Yeah.
Talk about some of those testimonials for the person that's watching right now. They're kind of unsure. I don't think I need it, but I think I do.
Yeah.
I think I do. How would you say those testimonials, those people that really have changed their life for the better?
Yeah.
Give me just a couple of good stories like that.
I'll give you the best story of all.
Okay, come on.
This one's tough, so it's going to be tough to hear, all right?
Okay,
so
all right. Well, hey, I'm a big boy. We got some big boys.
Get ready. Because I don't know. Well, there's a patient of mine that he actually had a fall at work and ruptured his urethra. He straddled something and tore up his urethra and had to have emergency surgery at Duke to repair it. Well, the problem wasn't the side effects of that. It was permanent ED. Erectile dysfunction, couldn't get up anymore. And he tried everything. He tried meds, he tried shots, he tried all this other stuff. It didn't work. And I will never forget the visit we had in my office talking to him and his wife, 35 years old, both of them in tears because they wanted a baby. They had one child already and they wanted another. Well, you got to have the tool to work with if you're going to have a baby, right? You can't have it be limp. And he said, he goes, I want to be able to make love to my wife and do it the natural way. Put an implant in him and really, truly change his life. And that was one of those kind of pat myself on the back because it makes you feel good that you're finally taking care of stuff like that.
That's good. Now, does it affect for those people that want to have a child? Does it interfere with that, or everything is just
everything is normal? Yeah.
Wow.
Yeah, it's a little pump that goes inside the sac. You pump stuff up, you get erect, and then the process is all the same as like it would be normally.
Yeah, so that's how the implant works.
Yeah.
Is there anything I got to do to prepare the implant before I...
All you got to do is be ready to go.
What? Oh my goodness. Oh, wow.
Yeah. I got to tell you, I'm going to tell you this right now. I've actually had a couple of my patients tell me they've woken up to their wives pumping their implant.
Are you serious?
Yeah.
Baby, give me right.
Yeah. You're like, wait a second, what's going on?
Give me right.
I guess it's time to go, but it's time to go. Yeah.
Wow.
Yeah.
Now, does it affect the sensation for men?
It doesn't. No.
Not at all.
It doesn't, I don't want to ever tell anybody it enhances the sensation, but because it allows you to get back to where you want to be, it helps things along because now you have rigidity. So you're not as soft, you don't have the same issues, you're not the frustrations, all the rest that are going on. So now that you get this nice rigid erection, the sensation's good.
Wow. I know some people are watching right now saying, I need to go see Dr. Natale. Like right now,
Yeah.
What would be the first thing that you would suggest to them? I'm sure it wouldn't be, hey, get an implant.
Yeah,
You know,
absolutely.
it may be, steps that they have to take before we even consider that.
Exactly right. I have them come in. We'll do a counseling session. We do an examination. We, check things out. I might have to do some blood work. Review your medications. Look what other things we've tried in the past. What's failed. If you've tried nothing, then we do the whole medication route. So it's a multi-step process. You're not going to get an answer right away. We're going to build up to whatever we need to. And maybe you are the guy that takes the blue pill and you're great. And maybe you are the guy that has to do surgery.
Yeah.
We can offer anything in between it and all of it kind of stuff for the right guy.
I love how you said
Yeah, man.
build up. Build up. Okay. All right. And then you said anything in between. I'm trying to stay focused right here. Because we're helping people right now.
We're doing it.
We're helping my men, we're helping my brothers, we're helping my fathers. But there may be somebody that's watching right now saying, okay, I know I have an issue, but I don't want to just jump into medication.
Yeah.
Is there any natural remedies?
So, other than the whole lifestyle stuff we talked about, weight loss, exercise, quit smoking, if you drink more than you should, quit drinking, all the things that we know are good for our body, do.
Yeah.
After that, there's actually some amino acids you can take, L-citrulline or L-arginine. They can kind of boost some of the function as well. So guys who are like a little bit skittish about getting on a med, I'll put them on something like that as well. That does help some.
Wow. All right. Any final words, Doc? Because, hey, man,
Yeah.
you really blessed a lot of guys
Oh, man.
today that just really probably saying, hey, I struggled with it. I was uncomfortable. I did not know all that it entailed, but watching this video is really going to help them out.
It's a serious issue that I think we kind of hide from. We don't want to address it. I know this all the time. Guys don't have the ability to really step up to the plate and take care of their health issues. We tend to hold stuff in and we don't want to talk about it, particularly if it's something that embarrasses us.
Yeah.
I can tell you, man, we've had these things, we've had erections since we were babies, right? And to have that taken away from us is a big dramatic change. And it affects you here, in addition to down there, right?
Yeah.
So getting that help you need is so important to get you back to feeling good.
Yeah.
And the reality is, like I told you earlier, sometimes we pick up other issues that come along with erectile dysfunction. So come to your doctor, talk about it so I can give you the right counseling.
Wow.
Yeah, man.
How do they set up an appointment with you today? I know you're watching. I know you want to come see my doc. How can they connect with
Right,
you?
the phones will be blowing up.
Yeah.
No, listen, there's a couple of ways you can do it. The easiest way to learn more about me and learn more about my practice, you can go to www.charlottesmenshealth.com. If you don't go there or you want to call directly to our office, you can call my office at 704-786-5131. That's the main line. Schedule an appointment. You do not need a referral. Just say, hey, I want to see Dr. Natale. We'll get you booked.
Thank you so much, Doc. He's not just a urologist, he's the president. That's right, Dr. Richard Natale right here at Carolina Urology Partners. Thank you, man. I really
My pleasure,
appreciate
man. My
it. And I'm
pleasure.
sure all of our viewers appreciate
You got
it
it.
too.
You got it. I'll get you your appointment card later, too.
All right. Okay.
I mean, wait. We're not supposed to talk.
Hey, listen, it's okay. It's okay. We got issues sometimes. I'm here to get it fixed. All right? Thanks so much, Doc.
Yeah.